Welcome to a SimHERA/SimHBA tutorial on crossover hearing and masking. This is going to look a little different than the other tutorials because this is actually a PowerPoint to give you some information about what crossover hearing is and how we can use masking to help reduce crossover hearing. So let's get started with this. We have our patient set up. We have some TDH headphones on and we've diagrammed the little cochlea here for the right ear and the left ear here in blue. And we're going to be presenting sounds to the test ear, and the left ear is the non-test ear. On the right here we have the patient's true audiogram. So we can see here that we have an asymmetrical, actually a unilateral loss with a fairly substantial asymmetry here. We're going to be giving this demonstration based on the 1000 hertz threshold because we'll be putting in a 1000 hertz tone. So we're going to be testing the right ear and presenting sound to the right ear, and in this case we'll present 50 dB to the right ear, and we're going to see how that crosses over into the non-test ear. So you need to know a little bit about interoral attenuation. Now the sound will cross over and through the bone, skin, and be conducted from the right ear through to the left ear. So right cochlea to left cochlea. So the amount of interoral attenuation is dependent on each patient and their patient's physiology and structures. The different frequencies will have different interoral attenuations. So too will the different patients because they have different structures of their skulls, scalp, fat tissue, so on. In this case, this patient has a 40 dB interoral attenuation for a 1000 hertz tone. So if we put in 50 dB HL at 1000 hertz, there will be a minus 40 dB as it crosses over into the non-test ear's cochlea. That will leave 10 decibels of hearing level in the left cochlea. So essentially it'd be like saying, I'm testing the left ear with 10 dB HL. The patient responds. You don't know whether that was due to the right cochlea hearing the sound or the left cochlea hearing the sound. So if we look over here at the audiogram, we put in 50 dB. There is a 40 dB interoral attenuation. So the effective stimulus energy entering in the left cochlea is 10 decibels. And that is above the hearing threshold of the left cochlea. So patient would have heard that sound in the left cochlea, the non-test ear, as well as the right cochlea because it is at threshold. So there's the dilemma. We don't know which ear is responding here. So let's move on to putting 40 dB into the test ear, the right ear, and see what happens. We have a 40 dB sound coming in, crosses over. We get an attenuation of 40 dB through interoral attenuation. That's 0 dB HL into the left cochlea. The patient raises their hand. That seems odd because 40 dB is below the test ear's hearing threshold of 50 decibels. But that is because their 40 dB crosses over into the non-test ear and still has 0 dB HL, which is the hearing threshold for the non-test ear, and the patient hears it in the non-test ear only. So the sound is heard in the left ear only and the patient responds. If you didn't know this left ear threshold because you started testing in the right ear, you would think that the patient responded at 40 dB to the right ear. Let's move on to doing 35 dB. Let's say we test at 35 decibels. We're going to get -5 in the non-test ear. And now that is below, if we take a look at the right, that is now below their non-test ear's threshold. So the patient doesn't respond. But because we had a response at 40 dB and a no response at 35 dB, if we didn't know about the non-test ear's threshold, we would incorrectly score this at 40 dB HL for the test ear, the right ear, which is 10 dB underestimating their hearing threshold. So how we compensate for that is to put in contralateral masking. And so in this case, we have that 50 dB HL in the right ear And we this time put in masking noise in the non-test ear, in that left ear. And we are putting in 30 dB HL of masking noise. This, for this patient, which we'll see later on, is 20 dB of effective masking. So that's that 20 dB EM. Now in SimHERA you can put it as dBHL masking or dBEM masking. So what is happening here is that the masking is making that left cochlea busy. It's listening to the noise. So when the 50 dB sound comes in, those nerve fibers in the cochlea is going to be actively processing the noise and not detecting that crossover from the right ear. So that when that crossover stimulation happens and you do get 10 dB HL in the left cochlea, the left ear will not be hearing it because it will be under that elevated threshold due to that masking noise. So the patient now responds, but they're responding because they are hearing it in the right cochlea, not the left cochlea. So essentially what you're doing is isolating out that test ear from the non-test ear. And then you go down to 40 decibels. Again, that 40 dB down. Now you're getting to being 0 dB HL in the non-test ear. And again, that is lower than the elevated threshold due to the masking noise. So nothing is heard because you're also lower than the threshold in the right cochlea. So the patient doesn't respond. And then we go up 5 dB. And again, crossover is happening, but because of that masking, we're still lower than the threshold of elevated masking noise threshold in that left ear, non-test ear. So you don't get a response, and again, you don't get a response for the right ear because again, we're lower than the right ear threshold. So nothing is heard, and then the right ear threshold is correctly scored at 50 decibels HL. So let's move on and talk about effective masking level. The effective masking level, so 0 dB EM, is the dBHL of masking noise required to mask out a 0 dB sensation level. And how do we determine this level? Well, we simply put in a certain level of masking noise in the non-test ear, or in this case, it will be the test ear because we'll be presenting a sound to it. But essentially, think about this, we're putting in a masking noise in the left ear, and then we put in a signal that is 0 dB HL, or in this case, 0 dB SL. Does the patient raise their hand? In this case, yes. So the 5 decibel HL masking noise was insufficient to mask out a 0 dB HL sound. Then we just raise, so they didn't hear it, we just raise the masker. We'll put in 10 dB HL. Is that sufficient to mask out the 0 dB HL sound? Sound comes in, patient does not respond, so it's just sufficient to mask out that 0 dB HL sound. So 10 dB HL is the masking level required to mask out a 0 dB HL sound. So the effective masking level, the 0 dB EM in this case, is 10 dB HL for the 1000 hertz. Now all patients will be different. They'll have different dB HLs to get 0 dB EM. Most clinical audiometers use a standard reference when they're calibrated. So if you are selecting the dBEM, remember that that is an average across patients, and it is not what the actual patient will be. The EM level might not be sufficient to mask out hearing sounds for specific participants. And that's why we use a safety factor as well. Okay, so here we've moved on to showing how you can set the dB HL for the effective masking in SimHERA. And this is how we do it. So if we just click here under Simulate Case and then effective masking of left and right, what we can see here is the true effective masking levels in dBHL. So this will be for your behavioral testing. And then it's in dBSPL because that's what the normative data are published in for the different electrophysiological measures here. But for the behavioral, what we can see is I've already set this at 5, 5, 10, so on and so forth across the different frequencies for the amount of masking noise needed to mask the stimulus energy at threshold, so 0 dB SL, as we mentioned before. And so that's what this is set as in SimHERA. So this will be dBHL. That 10 dB HL is your 0 dB EML, or effective masking. So if we go back to the behavioral tab here, what we can see is we have down here in the audiometer section, masking, and you can put in broadband masking, and you can set that to dBEM, so that corrects for that 10 dB HL for this patient. Or we can set it as dBHL. So there are two ways to do this. Typically, clinical audiometers will set this in dBEM. Those are the calibrated EM level value references that are done for calibrating the audiometer. But keep in mind, that is an average across multiple patients. The dBHL is the true masking level that we would have for this patient. Every patient has a different masking level, as just described previously. So keep that in mind when you're doing dBHL versus dBEM. I leave it up to your clinical instructor telling you which one to use, but you do have that option as dBEM or dBHL in SimHBA, which is in SimHERA. So now we're back to looking at bone conduction crossover hearing. We have now on the test ear, or right ear, we have a bone oscillator on the right mastoid, and we have a supraoral TDH headphone in the left test ear because we're going to be needing to apply masking. And that is because the intraoral attenuation is 5 dB for the bone oscillator. And that's because the bone are really tightly fused together, especially in adults, so that energy that you're oscillating on the right mastoid, which is the right temporal bone, transfers right across to the left temporal bone and into the left cochlea. So you get a very limited amount of intraoral attenuation when you're talking about bone oscillation. Okay. So let's take a look at that. We put in 40 dB HL on the test ear, which is the right mastoid, and because it's only a 5 dB intraoral attenuation, we have an effective stimulus going into the left cochlea of 35 decibels HL. And that is well above their hearing threshold, as we can see here over on the right, and they raise their hand. So let's take a look at how we're doing that with a little diagram. We put in 40 dB in the right, which is below their hearing threshold for the right cochlea. But because we only get a 5 dB intraoral attenuation, that's effectively 35 dB in the left ear, which is well above their hearing threshold, and they raise their hand and respond. So because there is so little intraoral attenuation, we could even go down 5 dB HL and still get a response from this patient because that is at their 0 dB hearing level that we have here. So the patient responds because they're hearing it in their left ear due to that crossover. So essentially, we really need to put in masking noise when we're doing bone conduction. But I won't give you specifics here because different clinical protocols will say when to mask and how much to mask, and I'll leave that to your clinical instructors. But now you have a good understanding, hopefully, of how intraoral attenuation plays with crossover hearing and how masking can help reduce that crossover hearing so you get a more accurate estimate of the patient's behavioral hearing thresholds. That's it for this video. Please check out how to do masking when performing behavioral audiometry in SimHBA and SimHERA. I hope you enjoyed this video. Have fun learning.